and welcome back to Dr. Noah's YouTube update, oxidative stress, Protandim, and depression and chronic stress accelerates aging. What was interesting in this article here, and this was from Biological Psychiatry, September 2011, is that people with recurrent depression or are exposed to chronic stress exhibit shorter telomeres in white blood cells. But they go in here that telomere is this kind of space age type of technology. Now, telomeres on your chromosomes are these little tips. They use the example of a shoelace where you have the plastic on the end, and that prevents the chromosomes from kind of falling apart. It keeps them together. And over time, every time a cell replicates, the telomeres can become a little bit less and less, and that actually is a sign of aging. And in my practice, as well as some other doctors, we can actually test that now, find out where your telomeres are. And it was just a big enough deal in 2009. It created 3 scientists to have a Nobel Prize award. So I mean, this is really cutting edge and kind of exciting. And then what they were able to show here is that telomeres, the outside part of the chromosome, with increased aging, telomeres shorten. And studies have shown that oxidative stress and inflammation accelerates the shortening. So if you're able to, once again, able to reduce oxidative stress, you're having an important part in not only diseases we'll talk about, but also how long you're going to live. And that's what Protandim is so exciting to me, is that within 30 days, published in a very peer-reviewed article in Free Radical Biology, is able to reduce your oxidative stress down to a baby. Profound. Irregardless of whether or not you feel differently, that's what's happening when you take this particular type of compound. So that's an important. Here's another study here published in ACTA Neuropsychiatry, which is a Scandinavian psychiatric drug journal. The relationship between potency of oxidative stress and severity of depression. And they go on, is oxidative stress is high, your depression is going to be worse. Lower antioxidant, your depression can go away. And that's exactly what they're doing here. Published, once again, in scientific articles. Another article here, published in, what is this, published in Clinical and Experimental Journal, October 2011. Major depressive disorder is accompanied with oxidative stress. So this is a well-established scientific, biochemical, no BS type of situation. Depression and oxidative stress are one and the same. High oxidative stress, yes, you could have mental problems. Low oxidative stress, less. A simple product like that, Protandim, 1 a day, very inexpensive. This has profound benefits, as we've talked about, over 225 diseases. One of those are mental health issues, and just explained in terms of just depression there. So, very, very powerful medicine.